According to the Center for Disease Control, over 18,000 Americans die every year from HIV. Since 1981 to 2007, over 576,000 people have died in the United States of AIDS. Hi, my name is Shannon Toussaint. I'm an LPN, and today I'm going to talk about HIV, the virus that causes AIDS. My main points will be on causative agent, pathogenesis, epidemiology, signs and symptoms, and prevention and treatment. HIV originated in West Africa and is said to believe by scientists that it came from a chimpanzee, which later on crossed over to humans many years later. The causative agent for HIV is HIV-1 and HIV-2. HIV-1 is found in the United States and most other parts of the world. It is said to be more potent. HIV-2 is found in West Africa. It is distinctly antigenically different, but even though it's less potent than HIV-1, it is said to be that a lot of people die from HIV-2 in West Africa due to lack of resources. The pathogenesis of AIDS, it attacks the immune system, mainly the T helper cells and lots of other cells, macrophages and CD4 receptors. Eventually, the immune system loses ground and becomes too impaired to respond. In nearly 80% of all cases, the immune system slowly loses the ground to the virus. CD4 cells drop nearly 50 microliters every single year. Symptoms usually appear when count falls below 200 microliters and is said to believe that you have AIDS. A typical progression of the disease occurs usually in 10% of infected individual. The disease progresses rapidly in AIDS. Within a few months, you die. Another 5 to 10% of the individuals do not experience a fall in their CD4 cells. This is individuals such as Magic Johnson. They maintain high levels of antibodies on their CD8 cells, and the disease progresses slowly. The epidemiology, according to microbiology, a human perspective, three different ways of transmission. One is sexual intercourse. Next mode of transmission will be through blood and blood products, such as sharing needles or a blood transfusion. The third and last way of transmission would be mother to infant by breastfeeding, or if the mom does not take any retroviral drugs while pregnant. The symptoms appear in incubation of period of 6 days to 6 weeks. They usually consist of fever, headache, sore throat, muscle ache, enlarged lymph nodes, and generalized rash, kind of like a cold. The symptoms are known as acute retroviral syndrome in HIV, and they typically subside within 6 weeks. In AIDS, it is known as AIDS-related complex, and these symptoms are fever, weight loss, and fatigue. Another symptom with HIV is known as candidiasis, which is a white thrush surrounding the tongue. A lot of patients with HIV consist of these symptoms. Prevention and treatment. There is no approved vaccine for this virus, and most people infected are unaware. The best way for prevention is knowledge. If you know a lot about the virus, you would know how to protect yourself. As far as sexual intercourse, the use of condoms it's not 100% effective, but it can help prevent the disease. Avoidance of practices from the virus is the best way. Treatment. Treatment is a cocktail of drugs, a combination of reverse transcriptase and protease inhibitors, known as HART, which is highly active antiretroviral therapy. The reverse transcriptase inhibitors consist of two types, nucleoside and non-nucleoside. This is a sample of the reverse transcriptase. The protease inhibitors, which is another form of treatment for the HIV virus, is also a part of the heart, but heart does not cure AIDS. Many strains fail to respond to heart due to resistance of the disease. Now that I have went through the symptoms, the pathogenesis, epidemiology, symptom, and prevention and treatment, the number of new infection continues to rise every year, and an average of 56,000 people are infected every year. It has been over 3 decades since HIV discovery, and with further research from the scientists from the CDC, we now have a basic understanding of HIV, the virus that causes AIDS. Thank you.